this webinar in just another webinar this month. We want to thank you for participating. This webinar is sponsored by the Minnesota Gerontological Society and the University of Minnesota Center on Aging and MAGIC. So many people have expressed interest in our topic today, New Americans, Solutions to Workforce Challenges in Long-Term Care. My name is Pat Schomer, and I am your moderator for today's webinar. I'm with the University of Minnesota Center on Aging and the MAGIC program, as well as a member of the MGS board. MAGIC, if you aren't familiar, stands for the Minnesota Area Geriatric Education Center. These monthly webinars have become a hallmark of our two programs, and we want to continue to bring timely topics to you and to your organization. As I mentioned prior, handouts for the webinar can be downloaded at mngero.org. You don't necessarily need them today. You can follow along with the slides on your screen, but a number of people have asked for those handouts to have in their hands during the webinars, and so we have provided them for you. More details and information about upcoming webinars can be found on our MGS website. Same website, mngero.org. That's mngero.org. A few logistics for today. Your conference audio is muted. If you have a question for the speaker, please feel free to type the question in the chat area at the bottom of your screen. If you have to leave the webinar early, just close your browser and hang up your phone if you're using the phone. If you have other questions or concerns, please feel free to email us at MGS. After the webinar today, you'll be emailed an evaluation. We're interested in learning about what you liked, what you didn't like, what you think we can do better, and any future topic ideas. We take your information to heart. Further information on continuing education credits will be available at the end of the webinar. There are a few groups of facilities that are participating today. If each person wants a CEU certificate, the supervisor or person completing the survey after the webinar should list each staff person and their email in the survey question. This is the only way we can assure that each person who wants a CEU gets one, and that is if their name and email appear within this question. We want to remind you CEUs are free for our members and $25 for non-members. Jane Gropin, our speaker today, is the Executive Director of the International Institute of Minnesota. This is a nonprofit organization that helps refugees and immigrants reach their full potential. During her 25 years with the Institute, she has been instrumental in creating a nationally recognized medical careers pathway, a top-performing refugee resettlement department, and for other services that help new Americans maximize their talents to become fully contributing members of our American society. Jane, we're pleased to welcome you today. We're pleased with your willingness to speak today. We are excited to hear about this topic of New Americans, Solutions to Workforce Challenges in Long-Term Care. And so, Jane, I turn this over to you now.
Great. Thank you so much, Pat, for that nice introduction. And hello to everyone, and it's a pleasure to be able to present to all of you on this topic. Let me just also remind people before I begin that feel free to type in questions, and we'll take them as we go and not save them all to the end. So feel free. I hope this will be as informal as we can possibly make it with technology. So again, thanks so much for having me. So I'm going to get started just to give you a brief description of what the work is that we do at the International Institute of Minnesota. So we're a nonprofit that provides comprehensive services to new Americans. So we serve refugees and immigrants and who arrive to Minnesota with really a range of skills. So we say pre-literate to PhD, and that really is true. But I would say that most of them are sort of in the middle of that space. So people come to us, or we greet people at the airport. That's part of our job, is resettling new refugees. And so some of them are pre-literate. They haven't learned to read or write in their own language. And some of them have PhDs. But as I said, most of them are in the middle of that space. So one thing I want to say that I've been at the Institute for 25 years, and one thing that's really changed pretty dramatically about the work that we do here is when I started 25 years ago, refugees had been living in refugee camps for 3 years on average. And at that time, the camps had decent services for folks. There were language supports, pretty comprehensive orientations to the United States, what to expect when you arrive, what does employment look like in the United States. That has completely changed. The average stay for a refugee in a camp now is 17 years. So you can imagine the impact that that's had on people's physical health, their mental health, and also in the camps there are very few services, which actually might be an exaggeration in the positive. There's really no service. And so when they arrive, we're asking them within a week of their arrival to the U.S. and to Minnesota to start looking for a job. And we always have to remember that many of the refugees that we serve have been in camps for 17 years with really nothing to do. So I also just want to brag for 1 minute and let you know that last week we were presented by the United Way, had their 100th anniversary, and we were awarded the 2014 recipient of their Community Impact Award for the work that we do in our medical careers pathway. So next, I want to talk about how did we get into healthcare employment. So I'm sure many of you are wondering, how did an organization that works with refugees and immigrants get into this area? So 25 years ago and still today, we had many people coming to the Institute as immigrants, as refugees, would come to our agency, and they had a lot of experience in healthcare. So some of them had been medical doctors in their countries, and some of them nurses and other physicians. So they would come to us and say, I want to work in healthcare. So 25 years ago, our response would be to send them to our area community colleges for nursing assistant training, because that was the entry-level training. So if you recall 25 years ago, nursing assistant training at community colleges was 2.5 days in length. So that's been a big change over time, and those trainings are now longer. But we would send folks to those trainings, and they would come back to us again, some of them doctors, nurses in their countries, very sophisticated folks in terms of their education level and their language skills, and they would fail the courses, and they would fail the nursing assistant test if they made it that far. So we thought, something's wrong with this. So we took a curriculum that was at that time 2.5 days and made it into a longer curriculum. And I'm going to talk about nursing assistant curriculum, and I'll talk about the details of the nursing assistant training program in a minute. But that's where we started in this pathway. Over the years, we have added steps along that pathway. Just last year, we started a pre-nursing assistant training because we found that when we do our testing, many students weren't ready could not pass our entrance exam, but they only missed the score by a couple of points. So we started a class for them to give a booster to their language skills, but in the context of healthcare. So integrating the nursing assistant terminology so that they were exposed to those terms before they got into the nursing assistant training program. And that has been very, very successful. So we also added, we had nursing assistants in the field after 5 years of starting that program. They came back and said, I want to be a nurse. So we started a medical career advancement program to help folks move up the career pathway and into higher paying positions. We also started college readiness classes in this pathway, and I'm going to save the explanation of what those are to a later slide, because I'm going to talk about that in quite a bit of detail. But the short of that is people needed more help with language skills and help navigating higher education in Minnesota for them to be successful there. So some other components that we've added recently to our healthcare pathway is at the community college. St. Paul Community College is our community college partner, and we recently added a phlebotomy training program to our pathway. So there were some of our graduates who'd been working as nursing assistants for many years, but knew that they weren't ready to be nurses yet, that felt like too big of a step for them. So phlebotomy is a much shorter training, 1 semester, and so we've had quite a few people graduate and become employed as phlebotomists. And then anatomy and physiology, as most of you know, is a gateway course at community colleges for healthcare. So our instructor co-taught the course with the St. Paul College instructor so that students would be successful in that course and then could, in fact, go on to LPN and RN coursework. It's been very, very successful. We just tracked our data, and all of the students that worked with our instructor, both in the bridge class before the actual anatomy and physiology course, and then the support class during the class, got an A or B in the class. So it really has helped people be successful in that course. And the College Readiness Academy, as I said, I'll talk in detail later, but that's a new initiative that we started this year as well. So let me talk a little bit in more detail about the nursing assistant training at the Institute and why the program is successful. And I'll give you some data to prove that success a little bit later in the presentation. One thing that's really key to the success of this program is the assessment. So before people even get into the program, the Institute has designed our own test, and it's a written exam is one of the components. So we test for language skills on that test, but we also test for their knowledge of the workplace and some aptitude for nursing assistant work and knowledge of that field. It also includes a very deep explanation about what the job is, so that people are very clear about the physical demands of the job, and we give very clear examples of tasks that they will be performing. So they're really clear about what the work is before they get into the training. We also do then, with people that pass the exam, we do a one-to-one interview with students, with those students, to make sure that we know them, they know us, they understand the training, they can ask questions, and that they're really ready if they are accepted into the training. So it's quite a rigorous assessment, and that's really been a big key to the success of our program. I want to make sure that people are ready to be in the training. So as I said, we have an 8-week and an 11-week training. 8-week training is for people that have a little bit higher language skills and can make it through the training more quickly. And so integrated training means that we have an English language instructor that works with our nurses on staff. And we have 4 nurses on staff, which might surprise you. But the nursing instructors and the English language instructors work as a team to deliver the curriculum. And we call it layered learning. And what we mean by that is, for example, when our nursing instructors are teaching the bed making skill, which is one of the first skills students learn, the English instructor makes sure that before the nurse comes in and talks about the concepts and the why behind bed making skill, that the students know what a fitted sheet is, what a tuck pad is, what a top sheet is, and all the things that we put on a bed. So they know the nouns and the verbs before the nurse is delivering the content, the nursing content. Otherwise, you know, if you've been living in a refugee camp for 17 years, you don't have a bed, and all the things that we put on a bed in a hospital are new for all of our students. So that's just one example of the many skills that they have to learn and how we do the instruction, and that's true for all of the curriculum. Then the ELL instructor sort of sets the stage so when the nurse comes in, the students aren't stuck on terminology and that those concepts are clear to them. So that's what we mean by integrated instruction, and it's worked very well. We always say our nurses become ELL instructors, and our ELL instructors learn a lot about nursing concepts. So some of the other training components that I think makes our program different than other programs in the community that we do spend quite a bit of time on financial literacy. So once you leave the institute and you go to work, what does a paycheck look like? What does Social Security mean? How do taxes work? Those are all new concepts to our students. What are the benefits that you might be offered? And we know those from working with our employer partners, and they share those forms with us so we can use real forms with students. We also spend a lot of time on communication skills, American communication skills. So how do we resolve conflict in the workplace? How loud do we talk? What sort of body language do we use? A lot of waving hands in Minnesota makes us uncomfortable. So how do we resolve conflict? And when is it appropriate to go to your supervisor if you're having a problem at work? And how do you have that conversation? We do also talk about cross-cultural skills in the workplace, very important. Conflict resolution is a part of that, as are many other topics that we address in cross-cultural skills for the workplace. We do integrate computer skills because most of our students are needing to have computer skills once they go to long-term care. And I'll talk about that more too. We do some training for point-click care with all of our graduates receive that training in our nursing assistant program. So a few of the other things I wanted to highlight in our training is that our clinical training for our students is 4 days, 22 hours, so quite a bit longer than what the state requirement is. We feel that's really important that our students get as much attention as they can on the work site and as much exposure as they can, because it makes them more competitive and better prepared for their jobs. The instructor-student ratio is 1 to 6. Really helps with our learning also. And I think that something that really speaks to the quality of the training and the dedication of our students is when Pearson VUE does our testing and they send us back our results of our students. As you may know, our students they compare our students to the rest of the test takers in the state of Minnesota. So the International Institute graduates and test takers outperform all other Minnesotans on that state exam, both the written test and the skills that they perform. So I wanted to give you some idea of scale of our program. We graduate approximately 140 graduates per year, and 98% of those graduates pass the state exam. So they're very well prepared for that. We spend a lot of time not preparing them for the test so much, although at the end we do spend some time on that, but really working on every student practices every skill and has to test out with their nurse instructor. So they're very well prepared once they get to the test. So I wanted to spend a little bit of time on our employment data. So 80% of our students that graduate from the program, that pass the exam, get placed in jobs. That's quite a high employment placement rate. And then once those folks are employed, 90% of them are still on the job at 6 months. And actually, we started doing 12-month retention tracking, and at 12 months, 86% of them are still on the job. So we feel that's quite a high retention rate, and employers like to know that and really value that. We have more than 60 employer partners that we work with, and a couple of those employers, 70% of their nursing assistant staff are graduates from our program. And I think that is a testimony to how well trained students are, but also because we're available to help troubleshoot with employers if they are having a problem at their work site with one of our graduates. We really try to help work through those problems when necessary. So once students lead the nursing assistant training program, and I'll talk about, we've had over 2,000 of our graduates are employed in the field. Many of them want to advance to become LPNs and RNs. And most of our LPNs and RNs do end up staying in long-term care because that's usually where they've started and they value the work. So we just started, got a large grant from MSP WIN, which is a new foundation of 11 funders in our area that are really trying to influence higher education and its efficacy, but also how adult basic education funding and workforce training happens in our community. So we started this College Readiness Academy to help new Americans and other Americans get really ready for college so that they don't get tracked into developmental education classes once they get to college. The data is pretty clear that once students get into developmental education in community colleges, so those are courses that have credits, but they don't, those credits don't help you with your LPN or RN degree. They don't count toward that. And once you get tracked into developmental education, the majority of people don't leave developmental education and they never make it into their LPN or their RN training. So we want to make sure that when students say they want to go to college, that they're as ready as possible so that when they get to college, they're going right into their LPN and their RN training programs. So this is a new effort, and we have the Hub Center and Neighborhood House in St. Paul College are our partners in this program. So we really have, we've been doing this work for quite a long time, 15 years or more, and we're just scaling it up because we know that once people get good college readiness training, they can go right into their college program. I just want to say also that St. Paul College has really been a great partner in that work and is really committed to helping students get right into their college program so that they can be successful there. So as I mentioned, we've helped more than 2,000 nursing assistants become employed in long-term care in the Twin Cities. The majority of them are working. And I think it's really helped a lot of our employer partners stabilize their workplaces so that they're, with those high retention rates, it's really helped to save employers both staff costs and time in training new employees, and then also just the stability of their workplaces and the quality of their care. A lot of our students have taken care of elders in their own communities before they arrive here and have a natural respect for elders. So it's really been a good match in that way. And then we've helped 370 folks advance to become LPNs and RNs. And we are hoping to increase that number quite dramatically in the next 5 years or so. And then 106 of them have gone into other professions in the medical field. But I would say of the RNs and LPNs, the majority of those graduates stay in long-term care because that's where they've been working and are comfortable. So in our medical career pathway, we're always talking to our employer partners. I just had the pleasure of talking to 10 of the CEOs of the long-term care partners that we have to ask them what are the industry trends, what can we be doing with our training that we're not. And so here are a couple of the things that we've integrated in the last couple of years in our training. We do a universal care worker training. Once our students pass the nursing assistant test, they can come back for that training. We do integrate point-click care training, so that electronic medical record training into our program so that our graduates are competitive and that they are prepared for that electronic medical record training once they get to the workplace. And then, as I said, we are always increasing our American workforce training, and a lot of our partners have said that we can't do enough customer service training. So we're always integrating some of those components into our program as the program continues. But continuous improvement is a goal for all of our programs. and all of our workforce training programs in particular. And our employer partners are always informing those improvements for us. I'm just going to go back to that and say if there aren't any questions at this point, I'm going to just end on kind of a, I hate to end on a Department of Justice note, but I just wanted to mention that if there are, I know there are employers listening to this webinar, and one thing that we've been getting a lot of questions about from employers, and my staff mentioned to me that would be important to talk about, is just the whole I-9 form. So once you do decide to hire one of our graduates or any other graduate, just to make sure that, I think there is some confusion about the I-9 form. And so one thing, I'm not going to spend too much time on this, I think the most important thing is the phone number there. And then also just really carefully reading the instructions on that I-9 form, because employers cannot ask potential employees for a particular document. And I think employers are doing that in good faith so that they are not running into problems down the line. So I think people are sort of overcompensating. But that is not legal to do. You cannot ask for a particular document. And a lot of refugees don't have their green card when they come to you for employment, but they are authorized to work. They are here legally. So just need to make sure that you are not asking for a particular document. And they do have a list of documents, list A, list B, and list C. And so just look carefully at the instructions there, and that you don't have to get just one document. There are other choices, and an employer cannot specify which documents that they get from the employee. That's up to the employee to give that to them. So just wanted to make sure that that's clear for people. So if there's any questions, happy to take any questions. If not, I'm going to end. We're located.
Well, let's just give them a minute here.
Yep.
And see if we have one person asking, what is the cost to the participants for this program?
Oh, good question. So there is no cost. Our training is free. Our students do pay for their exam when they take their nursing assistant exam, but there's no cost for the program.
Okay, and how is this medical careers pathway funded is another question.
Great. Right, so happy to make a call out to our funders. United Way is the largest funder of the program. The Phillips Foundation funds the program, the Marbrook Foundation, and MSP WIN is a new funder to the program.
Okay, another person asks, who are your long-term care partners?
Well, it's a long list. As I said, there's over 60 employer partners, but Episcopal Homes, Presbyterian Homes, St. Anthony Park Home, just down the street, it's very close to us, Ling Bloomston, are probably 5. Ling Bloomston used to be a clinical site for us. Episcopal Church Home is a clinical site. St. Anthony Park Home is a clinical site, but many other long-term care providers as well.
Okay, and what do you have to do to become an employer partner?
So good question. I've got, I can give, people can contact me, Jane Grotman, and I'm the executive director at the Institute, and I can direct you to our employment staff.
And Adam from Leading Age asked, do you need more employer partners?
Well, so that's a really good question. So everyone's been talking about the changes that are coming in the labor market, and because of the recession, we hadn't really seen that. We were able to maintain our 80% placement rate, but we didn't have, we weren't overproducing nursing assistants. We are starting to see an increase in the number of employer partners calling us. So we are going to be monitoring how many nursing assistants we train every year, and do we maybe need to increase that number? I wouldn't say we're at the tipping point yet. So yes, I think we could use some new partners, but our graduates are getting placed pretty quickly.
Okay, another person asks for your email, and it is on our website. It is jgraupman, Graupman, at M as in Mary, N as in Nancy.org. And we will post that again on our website. For your email contact, I think we've answered the next question about employers getting involved with the program. They should contact you. Another person asks, do you work with employers in Wisconsin?
No, we haven't. I mean, we'll have an occasional student that will move there, but there just is an occasional student.
Okay.
But certainly, I mean, we have helped some partners from other states with their model of training, just, you know, what we think works with our training. And I also really want to be clear that we've been doing this for 25 years, so, you know, that success has taken time. You know, it didn't just happen overnight. We've definitely been working on it for a long time. So, but really happy to share what we think in the training model work, why the training model works with people.
Okay, we've got some other people asking about employers outside of the Twin Cities area. We've got one person who mentions she's in St. Cloud, another person who mentions she is 30 miles south of Minneapolis, and another person mentions they are 180 miles from Minneapolis. So would you accept them as employer partners?
Yeah, I mean, I think for the people in St. Cloud, we do have students that live not, you know, in the northern suburbs, so wouldn't be too far from there, and then also 30 miles from the south isn't out of our range.
Okay, just because I know the St. Cloud area, for example, for a nursing assistant job, I honestly don't think that they can drive, let's say, from Anoka to St. Cloud and you know, have the car expense as well.
Right, right.
But hopefully you could expand a little bit. Another person asks, can participants receive help with transportation, child care, elder care, and so on to facilitate participating in the program?
Yes, yes. I think that's one of the keys to success, too, is we have a staff person in the training that helps people. So another thing, before they get to the training, that all that stuff is lined up so that it doesn't interfere with their success in the training. And yes, that's an ongoing service. It's key to our training model, yeah.
Okay, does anybody have any other questions or need further clarifications on the questions you've already asked? Pearl asked, do you follow up with students' performance in the long-term care organization? What about clients' feedback?
So yes, we follow up with our students. As I said, we do 6-month retention. But before that, you know, students call us for help, as do employers. And we stay in pretty close contact with our students. And then, as I said, you know, I just went out in the field and talked to, you know, 10 of our top employers to ask them for their input. But we want to know for sure, you know, one key to the training is that we are advocates for our employers and for our clients. I mean, that's really key for any training program. So we always are trying to understand what our employers need, how is their work changing. So yes, very open to getting input from our clients once they're in the field working and from employers.
Okay, Matt asks, if there was a demand, can you get more students?
So that's a good question. That changes. There was a time when for every person that we could accept into the program, we had 10 applying. I think it's not so much the case now. I think we're able to fill all the seats that we have for the training. If we doubled it, that would be then, I don't know that we could fill all those seats. So that's a really good question, and I'm not really sure about the answer to that right now.
Okay, do you know of any similar programs similar to yours that are in Wisconsin?
I don't.
Okay. Brianna asks, are there organizations that you work with outside of the metro area that could replicate the program for rural areas where there is an intersection of need for caregivers and new immigrants? And
Yes.
have organizations outside of the metro area expressed interest in this?
I haven't talked to too many of them directly, but I think that I know that in Rochester, Minnesota, probably about 5-7 years ago, we helped them to develop a training model similar to ours.
Okay, Sue has a question and a comment. She says, have you had an opportunity to share this program with the resettlement and refugee programs in other states? It seems like this is a great program to address workforce challenges in long-term care, which could be replicated elsewhere.
Yes, so the International Institute, we have a network, we have a national office in Washington, D.C., and there's 30 agencies in our network. So our institute in Missouri, in St. Louis, Missouri, started a program, and a few other of them have also. But our resettlement partners in the Twin Cities know about our program, and so, you know, that's definitely a possibility.
Good. Jane, do you mind moving to our last slide?
No. Yes.
Okay. If you've got further questions, please feel free to contact us at info@mngero.org. That's MNGERO.org. Our next webinar, as you see, is on March 25th on Workforce Solutions for Aging Services Careers, and it will be done by our own Adam Sumala from Leading Age and also a new board member for MGS. Also, please note that our conference is on Friday, April 24th. It is our 39th annual conference, and our topic is Designing Our Destiny, Aging Ain't for Sissies, Challenges, Opportunities, and Affordability. And I can tell you we've got two excellent keynote speakers. Dave Dernberger is speaking in the morning, and Nick Mezzacappa is speaking right after lunch. And they are both absolutely excellent, as well as we have some high-quality breakout sessions available for you. After the conference today, after this webinar today, the survey will pop up on your screen as you exit. Please fill it out, and remember again to give us names and emails for those people who watched the webinar or participated in the webinar with you. It will also show up in your email tomorrow. Continuing education certificates are available for today's webinar from the Boards of Social Work and Nursing. These are free of charge for our members of MGS and $25 for non-members. To obtain this benefit on a monthly basis, please consider joining us at MGS. The application is available on our website at mngero.org. An annual membership is only $75, and that's the cost for three CEUs for 3 webinars. So it really is cost effective to join us. You'll get CEUs for our other 8+ webinars we host each year free, and we'd love to have your involvement. Now remember, please fill out your evaluation survey. That's how we communicate with you. We greatly appreciate your involvement. We take your ideas and your comments very seriously. Please look ahead to our webinar on March 25th and our annual conference on April 24th. We appreciate you joining us today. And Jane, thank you so much for giving us this information on solutions to workforce challenges in long-term care. Thank you so much, everybody.
Pleasure. Thanks.